Okay, are we ready?
Good morning. Yes, we're taping.
Okay. Okay, June mother, your patient's Brady and Dan, can you come in?
Yeah. Take a look.
Patient is bradycardic. Physician is present.
Hi, how you doing? Oh, we got rate of 50s. Let's check our vital signs.
Yeah, so blood pressure I just checked, 112 on 56.
That's good. And is he talking to me?
He's feeling nauseous.
Nauseous, okay. So 112 over 56. Looks like 88%. We'll turn up the oxygen a little bit to 4 liters per minute.
Okay.
Okay.
And keep an eye on him.
Oxygen sat increased. Juma, do you need help?
Yeah, I could use some help. We'll put the call bell on.
Okay. We pulled the call bell. I can't feel a blood pressure. I can't obtain a blood pressure.
Any more?
No.
Okay. Let's check a pulse. Yeah. Do we have a pulse?
We have
Someone get the associate.
no pulse.
No pulse. All right. So this is a post-op patient. We got wires.
Yes, we do.
All right. So let's see.
Pacemaker on.
I'll just push the DO button and see if we can get going.
Okay. Wires.
Ventricular slide is hooked up, and yes, let's see if this works. If not, we'll start CPR soon. We still have 30 seconds or so. Nope, still nothing. Let's get the pads on, and oh, we actually do have a paced rhythm.
Do we have a blood pressure to go with that?
Let's check the blood pressure.
I don't get a blood pressure. Do we have a pulse? Do we have capture?
Do we?
We have some electrical capture, but we don't have mechanical capture.
All right, I'll start CPR.
Yeah. Call the code. Call the doctor. Come on in, doc.
All right. Oh, what's going on, guys? So can you guys tell me about the patient?
He's 3 vessel coronary artery disease, post-op day 2. Brady down this morning has been EA with an attempted pacing.
Okay, so you've got the maximal MA there. Can you guys call for help? So how many people are in the room here? So there's some people here.
Yeah.
So we need someone
Come
to
on in,
take
guys.
notes. So come in. I need one person to take notes. One person is going to take the airway for us. And he's doing some bagging. And we need 2 people behind him to take care of CPR. How many days post-op are we?
2 days post-op.
2 days
initial
post-op?
fast
You
track,
can
straight
go
forward.
over to
Can
release
someone call
CPR.
downstairs to get the crash card come
Yep.
here in case we need to open? What have we got for IV access?
We have a central line.
Yeah, so can we get some volume? I need somebody to connect some volume here.
A liter of saline has been.
Can someone verify again that the pacer is connected properly because we're not getting captured?
Can somebody reverse polarity of our pacer? It's over.
All right. So someone can manage the airway and put an oral airway in and bag. All right, who's going to bring our crash card? Did somebody call downstairs for a crash card?
Yeah.
Yep.
Yeah, ICU's on their way up the cart.
Okay, so you reconnected pacers.
Yeah, and we're DOO maximum up.
DO maximal, but it's still not capturing well.
No.
Still have no pulse yet.
No pulse. Okay, continue CPR until the card arrives.
Have we tried transcutaneous?
No, we haven't. So we can try transcutaneous for sure.
Here's your saline. You want it wide open?
23.
Can we get an amp of epinephrine here for me to give? I'm going to give just a 1 aliquot of it, so a small amount, 100 mics. Oh, rhythm went perfect.
That's CPR.
So what's the, oh, the CPR, is that my?
Yeah.
Okay, can you stop CPR for a second? Can somebody feel for a pulse?
Yeah, I'm feeling for a pulse.
None.
No pulse. Okay, so carry on with CPR. Yes, please. So can we give 100 mics, so it's 0.1 of a cc of
8.
Yep.
You want to take over for
10,
Juma?
11.
Yeah.
And what was the dose of that epinephrine?
100 mics in.
100 mics.
And how many mils is that? Please double check your meds.
0.1. Should be 0.1.
30.
Perfect.
Okay. And continue.
Did you call to the cart?
You have an advanced airway, so you can just do.
If somebody could,
CPR.
the person who's taking notes, could you check timing also for us, just to give us an idea of when we started? And how long it takes for,
Start CPR at 8:08.
so as hard as you can with the CPR. Good, sorry.
We
All
have
right, so
an
this-
end tidal CO2.
Yeah, is it, are we getting end tidal back?
Yes, getting in
We
touch with
are.
that.
Okay, so we've got, so we're in proper place for that?
Yes.
CPR for who's gonna get this?
What is our end tidal CO2 numeric value?
All right, Chris is gonna help me for opening. So in terms of help, who have I got here? So one of my colleagues is obviously here, Chris has come. The cart is there. Okay, so we still don't have a pulse. Can you stop the CPR, please? Feel for a pulse?
No pulse?
No pulse? It looks like I've got rhythm though. Is that
Get ready
not?
to swap CPR people while you're doing
Okay,
your
so
pulse
swap,
check.
next on CPR. Okay, so the sequence of events here is Chris is gonna be setting up the table right there. When we get Devin, who happens to be here also, is gonna help me for opening the test.
Does anyone call the OR staff? OR staff?
Oh, our staff, please.
Yep, thank you.
JF, you're 7.5?
Yeah, no, Devin is gonna take, he's probably an 8.
Devin was 7.5.
7.5, there you go. All right, so the sequence of things here, guys, is we're gonna set up to try to open the chest so we can find out what's going on, okay? So can we give another 100 mics aliquot of epinephrine?
You guys get it? Okay. Yep. Yep.
Okay, that's 1.1 mils, 100 mics in.
Okay, can you stop CPR for a second? What have you got? So still nothing.
Yeah.
Okay, so resume CPR.
Do you want a stool?
Yeah.
There's no pass. We should just, we'll have to add that to the list of things.
Do that, cool.
All right. Can we give this time 500 mics?
500 mics?
500, so 0.5.
Yeah. You want that right now or like a?
Right now.
Okay. 500 is 0.5 and it's in.
Okay, great. And in terms of volume, what have we got running?
We have saline running wide open,
Yeah, what was the last people go that we go on him?
normal.
Normal. Normal, full stop. Wow,
Yeah.
that's great.
This is 90.
Okay.
JF,
Yeah. Can we get some blood called up?
Yep.
For the
Jules,
patient?
can you call us a couple
Yeah,
minutes?
couple minutes of blood.
So the things we're gonna need for this is someone is free, can set up a suction system, so we'll need some suctions, I'll have some tubing.
Suction on the wall.
Great.
Then what we're gonna do is I'll give you a drape. Once we're draped, you're gonna start doing CPR. So once we drape, we're sterile, then you'll switch to 7.
Can you stop CPR for a second? Would you feel for a pulse? Feel for a pulse?
No pulse?
No pulse, can we change the person doing CPR?
Sure.
Person?
Prep on the chest.
Yeah, so for prep, you might throw prep and do nothing, don't worry about it.
So we have no temporary epicardial wires. When we get called, we get from the OR epicardial pacer wire.
Okay. Maybe someone can stuff like that, or maybe someone.
All right. Yeah, so you need a second hand for that, so are you gonna help him, Chris, and I got finished, what were you looking for?
Just epicardial pacer wires.
Okay, so they're there, perfect, so they're gonna
Are
get.
they there?
I know, I don't see anything.
We have them in the wire.
Do we have pacer wires? No. I don't see any of that. We need to
Call
have
down again?
Yeah.
That's why we do that.
There's none available?
Okay, continue CPR, so can you give another 500 mics of epinephrine?
Could somebody give us a recap of the amount of epi we have given thus far?
I'm giving 500 mics in.
For a total of?
1.200 mics or 1.2 milligrams.
Thank you.
Can you stop CPR for a second, feel for a pulse?
No pulse.
No pulse, no pacing.
So Denver,
Resume
as soon
CPR.
as soon as I'm gloving down, then I'll do CPR and you get,
And you get the-
you open the skin and
Okay.
open the chest.
Can someone call anesthesia for us?
Yes.
We'll see if we can get him here.
Okay. Like actually go down.
The cardiac anesthesia guys, obviously.
Oh, actually.
Yeah.
Okay. Here you go.
Sorry, we're making this real.
Number, I want to do that phone.
All right.
I don't know, but like a.
So someone's getting pacer wires, correct?
We don't have enough.
Someone's going to get some?
Go and get some.
Okay.
I don't know if you guys noticed, Chris is
Suction is.
right over the patient for CPR and quite rapid.
Here, I'll take your end of
So
the
that's great. So speed and not the elbow moving.
Do you
It's-
have wire gauges in your-
You also have an end tidal CO2 of 14
Where's the
now.
suction at?
Right
Okay,
here.
so and what was it before?
That's a good
Was
second.
9 when we started.
Okay, good. Good. All right, so we've got chest pressure there.
That was a second tray, Monica?
No, this was, same one, it's just that should be.
Okay,
Well,
stop
that's
CPR.
suction on. Yep.
So Ivan, you happen to be walking by, and I'm gonna ask you just to see if the OR or the room that would be ready to take the patient over if we need.
And we will peel the skin.
That's okay, that's what I would ask you.
Okay, I want you to peel. We're gonna peel this off.
All right. What did you guys find? Cutting wires, nice job. Who put those wires?
Susan Morris put those on.
We're coming up on the 2 minute mark.
Anesthesia's coming and cardiac. Yep. Yep, they're coming.
All right,
We got the retractor ready?
The retractor's kind of hard to get in.
Rhythm remains in asystole.
Great, okay.
You open it.
When was the last time since that happened?
2 minutes.
Yeah, doing internal massage.
Okay, it seems to be a lot of blood in pericardium.
Really good.
Suction it out.
Great. Anything change in the blood pressure? Good opening and chest?
Can we'll stop at what rhythm do I see? soon?
Rhythm. There's our rhythm.
Bottom right.
Sinus breath?
Slow sinus. Can we cycle a cuff pressure?
Sure.
Feeling a pressure on the aorta?
What do we
Yeah,
feel?
we have subclavian pressure.
Just cycling it now.
Blood pressure is 92 on 40.
Yeah.
Is there anything actively bleeding or squirting?
Yes, there is a small bleeder right where the anastomosis is.
Oh, we got our finger on it now.
Somebody should have the finger on that.
Okay, so
All
we'll
right.
get ready for transfer down to the OR.
Yeah, can we call the operating room and get an OR ready?
Okay?
And that's a wrap. We are transferring to the OR.